So here is my reply to iBarbies, who is asking about my current sciatica, herniated disc, progress, problems, how to deal with chronic pain, and stuff like that. So I'll just read her question out for you. Say, hey, I've watched most of your videos dealing with a herniated disc causing sciatica pain. I was wondering if you could maybe do an update video on how that's going, if it's healed, and some of your best tips on dealing with this chronic pain. I'll do my best on this. I'm currently suffering through this. Oh, I'm really sorry for you. I can barely walk to the bathroom before the pain starts shooting down the back of my thigh. Ugh. I've been trying to stretch more and walk around as much as I can, but I've spent the last few weeks about 90% of the time in bed. Ugh. It would be much appreciated. Thank you. Okay, so just to give you an example, I got an MRI scan on my spine, and this is what my spine looks like. So this white line here, that's your spinal cord, the nerve that goes from your brain, and there's bits that come outside of it all over the place. These big round bits, big square bits, that's the circular discs of bone in between the back, and that's the bone at the back as well. So that down here is my butt, over that way is my tummy. And this is my backbone, and that's just a bit of skin and fat at the back there. So in between each bone, you have your a cartilage disc, a disc made of fibrous cartilage. And as you can see, normally if it's good, it's nice and white, fine. And then down here, it goes squish, and it loses a bit of its whiteness. And then this bottom one, the really bad one, that's one that's causing all the trouble, totally squished. And it's pushing, so all it is pushing against the nerve. It's compressing the sciatic nerve. So this is the nerve which then goes down into your leg and into your foot, and sends pain messages up and down. And just from this simple thing there, squeezing against it, causes to the point where I can't feel my foot, I get numbness. I also get shooting pain down the back of both legs. Some people get down one leg or the other. And this one causes more pain in the upper part around the buttocks. So each area has dictates where you get pain in your body. So that's my current situation. Now, I originally had this problem about 2.5 years ago. That's when I got this scan. At the time, I was bedbound for about a week, and then it slowly got better and better and better. And I was going to be getting a surgery on my spine. So they would go in through my back, cut away this bone, push the spinal nerve out of the way, then scrape away that bit of the disc to take the pressure off the nerve, and then put it all back together. Slightly nerve-wracking. And with that, they said, there's only like a 1% chance of it going wrong, or another 1% chance of getting an infection afterwards, or a 1% chance of maybe an accumulation of blood which would make it worse, or another 1% chance of, and it just went up until it was like there's about 5% chance of it being worse if I get this surgery. So the day of the surgery, I went in, and I was a bit nervous. I hobbled in. I was like, can we just not do this? And they went, if you don't want to do it, we'll not do it. It's absolutely fine. And I was like, okay, yeah, don't do it. So, yeah, because I don't think I would get an insurance claim and be a millionaire. Oh, I'm paralyzed from the waist down, but don't worry, I'm a millionaire. You don't get that on the NHS. You get free medical stuff, but if it goes wrong, I don't think you get much help afterwards. So that would be I just thought I'll just deal with the pain. But amazingly, the pain went away, and I got to the point where if you go back through my videos to this time last year, 2015 summertime, I'm literally doing half marathons in the morning, running around the hills before breakfast. I'm just kind of going, yeah, I feel absolutely fine, no problems at all. Tight muscles. Maybe a little pain in the piriformis, which is a muscle in your butt which pushes against the nerve as well. And it was, I was super duper fit. But then it blew out again, or something happened and I got excruciating pain down the backs of my legs again. Couldn't walk, bedbound. So what's wrong? When we got the MRI scan, it's like, let's get another scan, see what the condition is. And they said, nothing has changed since the last time you got the scan. So it's like, what does that mean? What do you mean nothing has changed? Did it get better? And then I've blown it out in exactly the same way that it was blown out before. And they're like, we don't know. All we know is that it looks that the images are exactly the same as what they were 2 years ago. So the thing is, I don't know whether over time it just naturally healed itself and it went back into becoming a nice circular disc, or somehow the nerve pain just got used to it and all it's taken is a tiny little niggle and it's caused a serious amount of pain for the last 9 months now. So I don't know. That's the insane thing. So let me just give you some advice. I was wondering if you could maybe update a video. Okay, how it's going just now is currently I just have pain, numbness down my right leg. I've managed to come off all the painkillers. I went cold turkey and it's now just pain at a level which I can manage. I'm going swimming. I walk for my work every day, and I tried cycling. I've done cycling 2 times in the last week. So far, hasn't caused any problems. But it feels like any time I move, if I twist in a certain way, it feels like it could just go at any point. It feels like I keep on describing it as if my spine is made of dry spaghetti. You know, you can put stuff on top of it, but if I twist it the wrong way, it could just go shatter, and then I'm bedbound for however long it could be. Tips with dealing with the chronic pain. I don't. Just constantly taking painkillers is, and that's kind of pretty much what the doctors have advised me as well. Just like, oh, you've got terrible pain in your back and your leg and your spine. Yeah, painkillers. Here's nerve suppressant. Here's anti-inflammatories. Here's pain management drugs. Here's some stretches to do, and I'm just like, okay, none of these work. And even all the painkillers that they got, I was like, what was the other one? Diazepam and cocodamol and codeine and all that stuff. It can and like sometimes it's a case of like, am I actually having pain reduction, or am I just getting wasted on painkillers? What am I getting any benefit from this whatsoever? So I can't. I'm not really somebody to do it. All I can say is that the exercise which I found, which was helpful for me, was swimming. When I say swimming, I'm like, I didn't do it as an exercise. I just went to a pool, bobbed around a bit, and that was one of the only things that took pain off my back. I would be in the car getting driven to the swimming pool. I'd be like holding on to the handles at the side of the car, just going, oh, my back's sore, my back's sore, my back's sore. I'd hobble out of the car, get in a pool, and go, feel fine, cool. And I'd have half an hour in a pool just kind of going, and I wouldn't be like, I'm doing lengths or anything, but like, I'm just bobbing around, floating around, chatting away to people, and it was just like, pain's gone for a wee while. And when I'd come out of the pool, I'd be like, ooh, I feel okay for 5 minutes, and then I'd be like, no, pain's still there. The only thing I can say about it is that it's something which can heal. It can heal by itself, but the effects of it healing may only be evident at the very last moments of healing. So in other words, if I were to describe this, so let's say that's the problem there. Let's say that's 100%. It could go down by 50%, and I might still be in exactly the same amount of pain. It could go down by 90%. I could still be in exactly the same pain. It could be like 9 months later, and then it could be 1 week later, it's gone down by that last 2.5%, and I'm just like, wow, it's gone. Everything's fine. Or it's gone to the point where it's just a numb toe. This is amazing. So just because you're in pain doesn't necessarily mean it's getting worse or that it's not getting better. It may be the case that your body will be doing its best to get or to repair itself, but you won't feel any benefits of it. It's not like, hey, it's 10% better today, it's 15% better today, and tomorrow it'll be 20% better. You might feel no difference at all until 6 months down the road, you're like, I can walk all the way to the shops there. I feel fine. For me, it was like I couldn't walk around the supermarket holding a basket because the stress or whatever it was. I couldn't do that without having to like lie on the floor in the fucking refrigerator aisle. I'm like, I'm just gonna lie here for a minute. I'd be pretending to be looking at the ingredients of food. I'd be like on my knees at the refrigerator counter, just like, I'm just pretending to read this because I can't stand up at the moment, and then I'd hobble to the next place and just kind of go, where's all the toilet rolls? Let's just lie on the toilet roll. So it can be absolutely horrific, and it's not something which, like, even the doctors and all that, they're like, we can do surgery or give you drugs. They know more about... It's easier to fly a spaceship around Mars than it is to get clear advice on what to do with spinal problems. Like, doctors are like, spines, nerves, bones, muscles, joints, and all that stuff around that area. They're like, we don't really want to do anything around that. It's such... They would rather do brain surgery than spinal surgery because it's such a dodgy, scary area to mess around. It's like, even if the surgery's done absolutely fine, your body could still get maybe a bleeding nerve vessel, a bleed inside, and that can just make things so much worse. Additionally, a friend of mine, she had spinal surgery. It's called a microdiscectomy. Discectomy. Not dissectomy, it's a discectomy. And she says she felt great. Like, she pretty much skipped out of the hospital 2 days later. But then a month later, she blew out again, and it was twice as bad. So it's not a case of, hey, we can give you surgery and you're magically cured. It can be, we can give you surgery and a month later you could be back in here in even more pain. So it's not, there's not a magic bullet to it either. There is other, I've seen videos where like, hey, we put in fake discs or we get spinal fused, and there's just serious amounts of stuff going on there. So anyway, your last bit was saying, I'm currently suffering through this and can barely walk to the bathroom before the pain starts shooting down the back of my thigh. Where it is in the back of your, whether it's on the front of your thigh, the back of your thigh, your calf. For me, it's a lot of my calf and my foot was where the pain was. That can give you, you can research on it exactly where, which joint the disc problem is at, whether it's at L5, S1 or L4, L5, or where it is, that will, where your pain is will describe it, describe the actual damage that you've got before you even need to go get an X-ray or an MRI scan going on. I've been trying to stretch more and walk more. Again, that is a lot of the advice that people are given, to do a lot more stretch as much as possible, and I think I didn't get any benefit from stretching. I don't do any stretching just now whatsoever. I think one of the benefits of doing stretching is because potentially you're going to be so disabled for a while that your muscles are going to get tighter and tighter and tighter from lack of use. That tight muscles, when you've already got muscles which are potentially going to go into spasm because of the danger area in your spine, they're just like, just try and get some flexibility, because if it seizes up and you've already got tight muscles, that's going to make things a lot worse. So I don't necessarily think stretching will make things better, but it may prevent a bad thing being a even more painful bad thing. That's the only bit of advice I could say there. So yeah, if you can do stretching, what I would say other good stuff is heat. Sauna, like I've got a pattern on my back called, I can't remember the actual scientific name, but the doctor said to me, oh, you've got Granny's tartan leg syndrome on your back. And I was like, Granny's tartan leg syndrome? What the fuck is that? And it's where I've been using hot water bottles on my back so much for so long, it's damaged my skin. I don't know what it is, but it looks like, imagine you've been bitten by a zombie and you start seeing your veins and all that coming to the surface. I've got that on my lower back because I've had hot water bottles on my back, and it's called Granny's tartan leg syndrome, because old women would sit so close to the fireplace, the fire would be melting the front of their legs, and they would have all their veins at the front of their legs would be really obvious. and Granny's tartan legs. That's what it was called. So I've got that in my back from using hot water bottles. Again, you'll go to, some people will say do ice packs. Other ones will say do hot water bottles. Some people may say go from one to the other. Sometimes it's a benefit of if you're currently suffering from pain, the coldness can help reduce inflammation in the area. The hot water bottle can induce relaxation in the area. So it's not a case of just do hot water bottles or just do cold things. It's like it depends exactly where your condition is at a certain point. Is it the case of, oh, you've gone into spasm, you need to get a hot water bottle on to relax it. Once it's relaxed, maybe do a cold ice pack going on if there's doing any inflammation in the area, because inflammation can increase the more likeliness of it to go back into spasm again. However, ice packs and hot water bottles are only going to affect the surface area and have no effect on the actual spine, because what will happen is a hot water bottle will be here. It'll be heating up the skin and the blood area around this area. It will not be penetrating beyond your spinal bone here and getting anywhere near your nerve or anywhere affecting this whatsoever. But what you're wanting is hopefully the muscles around here can either be relaxing or just, sometimes people would just get more pleasure from having ice packs on there than anything else. But pretty much there's nothing you can do physically on the outside. Putting on anti-inflammatory cream around here is not going to affect your spinal disc in any way whatsoever. It may just relax your muscles and all that kind of stuff, but it's not going to have any effect this deep into your body or reduce inflammation around that. That's not going to happen. So again, anti-inflammatories unlikely to really have that much effect. It's because this isn't inflammation. This is a protrusion of your disc coming out. It's not like, your bone is sticking out of your arm and going, I'll take some anti-inflammatories, that will calm down the bone sticking out of my arm. It's like, no, your bone is sticking out your arm. It needs to either be put back in or scraped away. So that's all I can say really, is that if you are bedbound, try and relax as much as possible. I go for heat treatment, maybe ice treatment. Just be as careful as you possibly can, but don't think because you're not having any reduction in pain that there isn't potential slow progress of things getting better. It just may be that it takes a long time for it to get better. My current situation is, I think the pain that I'm in just now is totally manageable. Can't do long walks, can't lift stuff. I had my brother-in-law around today to do the mowing of the lawn, because if I have the lawnmower and I do a twist, it could just totally go. So my wife is the lawnmower man, and she's currently out of the country. My brother-in-law is mowing my lawn for me. So that's you've just got to be as careful as possible and do the stretching to prevent it potentially being really bad if something bad goes on. But don't think that that's going to cure anything. That's just stretching muscles, nothing to do with the nerve or the disc damage in the first place. Is there anything about diet that can help it? Mike the vegan has done a video about people having back pain, and potentially having a low-fat diet can help nutrients get into the lower back area and help repair there. So potentially, if you're going to do anything for your food, definitely, it doesn't have to be vegan, but potentially there is, from what Mike the vegan, Mike the vegan showed good evidence for, was a low-fat diet could definitely help in that area. I wouldn't say, hey, do that because that will help, but it is something that maybe is not a bad thing to do. But other than that, it's just I not really much more I can help on that one. Sorry about that. Sorry, because it totally sucks when it goes bad. And there is literally nothing you can do about it. apart from potential surgery. And for me, so what the doctor said for me is that this, because this is almost see-through, and this one is completely see-through, or black, compared to these nice, healthy white ones, that's showing DDD, degenerative disc disease. So they're always going to be like that. They're just going to get worse. But sometimes it can get worse, and you have no pain. Sometimes they can be like barely, or it can be blown out the other way, and people have no pain whatsoever. All I can say is that if you've got pain, but you're still able to go to the toilet, you're still able to actually walk to the toilet, even though it is in pain, that's better than what it could be, because there's another thing called equine equosis, or so, I've forgotten what it is, but it's effectively where the disc is blown out so far, it's affecting the nerves which affect your bladder and your bowel, and if that happens, you need to go to a hospital immediately, because if that goes any more wrong, you could potentially have amputations of parts of your body, because effectively it just cuts off blood circulation, nerve supply, and it goes back, and like you lose control of your bowel, you'll just like start pissing and shitting yourself. So just being in pain is a good thing compared to what it could be. And all I can say is just be as careful and as delicate and tiptoe as much as you possibly can. But there's no definite answer for how to make it better or how to stop it from getting worse. So sorry, Barbies. That may not have been the answer you were looking for, but hope that gives you some insight. Cheers. Bye-bye.